this listener says she suffers from osteoarthritis. I'm not sure what that is as opposed to arthritis, but perhaps you can tell us. And she has more limited motion in her knees because of it. She may need surgery, she says, someday, but in the meantime, I want to continue to stay fit. Some days I can barely get out of bed. I'm so stiff. What can I do to help myself while not hurting myself? And is that possible?
Okay, absolutely. This is a common problem with people that suffer from arthritis because they're in pain and it hurts to move.
And what is osteoarthritis versus arthritis?
Oh, you're getting really technical on me. I'll look it up.
Okay.
You know, typically we just make the distinction. Osteoarthritis is, we make this distinction between that and rheumatoid. Okay. And rheumatoid is more of, you know, the genetic, and that's really crippling. What we're going to be talking about today is more of just general arthritis, which is something, unfortunately, that comes with age. Also can come from repeated sports injuries or overuse injuries as well.
But you can avoid it as you age by doing exercise.
You can do things to make it better, tolerable, to not be in pain and not let it cripple your life.
Okay.
But like she's saying, she hurts so bad that there are some days that she can get out of bed. And that's the problem with arthritis, is that you're hurting and you are in pain so bad and you feel like you can't move and you're stiff and you don't, and that exacerbates the problem because you just continue to get stiffer. So, you know, they used to say years ago that if you had arthritis that you shouldn't exercise because it would cause more damage to your joints.
Right.
Well, we know now that that was ridiculous. You know, the medical industry, like everybody else, continues to evolve.
Right.
But now I'm not a doctor, so let's just, you know, put that out there. Everybody needs to go to your doctor first and talk to him about your problem and get approved for an exercise.
In the early days of really modern surgery, you laid in bed for weeks. Oh, don't move.
I know.
Now it's like they get you up after 5 minutes after the operation. They want you to walk back to the room.
My mother had a hip replacement. I walked in and they had her up. I said, "Are you kidding me?"
Yeah.
No, we're up and moving down the hall.
By the way, it's the internet to the rescue. Osteoarthritis is the most common joint disorder. So it's arthritis of the joints, and it's caused by, they say, wear and tear on the joint. So on things like the meniscus and that sort of thing. So you have wear and tear like cartilage and that kind of thing.
But you have to keep moving, because I tore my meniscus and I kept moving, not greatly, but just little by little by little, and took supplements.